I'm Yvonne Commodore-Mensah, Associate Professor at Johns Hopkins School of Nursing and Public Health with expertise in hypertension research.
My name is Valy Fontil. I am a practicing primary care physician, health services researcher, and implementation scientist at UCSF.
Can you talk to us about some of the health equity considerations? So, can you share with us the potential of home blood pressure monitoring with clinical support in reducing disparities in hypertension control?
I would say that it can help in a couple of ways. One is that with the proper support, home blood pressure monitoring can help reduce clinical inertia. And clinical inertia is the missed opportunity for clinicians to provide treatment when needed. When, say, a person's blood pressure is elevated, we often miss the opportunity to provide treatment intensification with home blood pressure. And oftentimes, one of the reasons behind that is uncertainty about the true blood pressure. And so, to that point, a well executed and implemented home blood pressure monitoring program can help reduce clinical inertia and can just essentially help us make the right decision to provide treatment identification whenever blood pressure is elevated. Another contributing factor to disparities is doctor patient miscommunication and maybe some level of distrust as well. Home blood pressure monitoring can also help with that because as a well-run program will then, as you're able to engage patients in monitoring their blood pressure, this provides the opportunity for education and training and facilitates communication because the patient themselves can know what their blood pressure is. They can then better understand why they might need treatment and can be engaged in that decision-making process. We mentioned that they do have a cost associated with them. And the first question is whether does insurance cover blood pressure cuffs? So Medicaid does cover home blood pressure monitoring devices, but it varies by state. When we're thinking about equity, we have to think about some of the difficulties that patients with low socioeconomic status, low income patients often have a hard time even making it to clinic. They often have interrupted cell phone services. All of these things are the kind of things that create challenges in terms of following up with your clinician and being able to communicate your blood pressure values to your clinician. And so this is a challenge that I think those of us who want to make sure that a home blood pressure monitoring program can be effective and sustainable in low resource settings, in safety net clinics or other clinics that are like safety net that have few resources, it's a challenge.